The outline for my talk is actually to speak to you about two very large topics in a very short period of time. I'm going to try and explain some definitions of multimorbidity and polypharmacy and how the prevalence of these conditions is increasing, how they arise, how they affect our patients, and ultimately how they really need to impact on the considerations that we make in terms of the treatment of our patients and the care of the patient who is undergoing that treatment. And in the short period of time available, try just to underline our position as healthcare providers in a bigger team, fulfilling our role in the wider care of this particular group of patients when they're becoming more elderly. Now, comorbidity is different to multimorbidity. Comorbidity means the coexistence of a disease or condition with a reference condition, and that's distinct from multimorbidity, where there's no single condition that dominates, which means it's particularly relevant to generalist care. And you see from the chart on the right the spread of different definitions that there are of multimorbidity. There are many different definitions, and that reflects the problem in treating the vast number of different types of situation that we see in this patient cohort. This is a fairly good definition of multimorbidity, but you can see again from the chart on the right that it's really only becoming more recently known that this is something we need to look at. The chart on the right reflects the number of publications in Medline using the word multimorbidity. But it's the coexistence of two or more chronic health conditions that collectively have an adverse impact on health status. But it is important to recognise that it's the patient themselves that is a big variable.